Good morning, students. From today we will be demonstrating the gross anatomy of abdomen. Abdomen is a very important area for any clinician, especially if you are aspiring to become a surgeon. We'll just begin with the introduction of abdomen, where I'll be demonstrating to you a few important landmarks on the abdomen. We'll go to the landmarks of the abdomen. So starting with the first, this is the xiphisternum. Xiphisternum is the lowermost part of the sternum. These are the costal margins. Costal margins. This is the anterior superior iliac spine on either sides, the iliac crest, and it ends in the anterior superior iliac spine. This is the pubis. The midline of the pubis is a pubic symphysis. This is a pubic symphysis, and if you trace it laterally, there will be a tubercle which is called as a pubic tubercle on either sides. As you all know, extending from the pubic tubercle to the anterior superior iliac spine, there is a ligament. Okay, if we dissect, if we go deep, we can see a ligament in this region that is called as a inguinal ligament, extending between the anterior superior iliac spine and the pubic tubercle. In the midline, you can see a very shallow furrow that is called as the linea alba. Linea alba, and on either sides there is a semicircular furrow that is called as linea semilunaris. So this is the linea alba and the linea semilunaris. So this is another landmark, that is the umbilicus. Okay, the umbilicus is a very important embryological landmark. This is where the fetus, this is actually a scar tissue of the umbilical cord, where the fetus is attached to the placenta through the umbilical cord at this level. So this is embryologically, this is a point where three system communicates with the umbilical cord. One is the vascular system, where the umbilical veins and the umbilical arteries communicate with the umbilical cord. Next is the vitellointestinal duct, which communicates the gut with the umbilical cord. And third is the urachus, which is the urogenital system that will be communicating with the umbilical cord. So this is one important point. Another point is that the umbilicus, the level of the umbilicus, this level is considered to be a watershed line, which means that the veins above the umbilicus, they go upwards, and the veins below the umbilicus, they drain downwards. There is no intermingling of the veins between these two levels. Another thing is that it is a watershed line also for the lymphatics. The lymphatics above the umbilicus drain to either the axillary or the cervical group of lymph nodes, and below the umbilicus they drain into the inguinal group of lymph nodes. So umbilicus is a very important landmark. Another thing that you should know about the umbilicus is the level of the umbilicus, that is the cutaneous supply at the level of umbilicus, is from 10 thoracic level, T10 level. So above it is this area supplied by T9, T8, and towards the xiphisternum the area of supply is T7, and below the umbilicus umbilicus is T10, so T11, T12, and just above the pubic symphysis this area is supplied by L1 level of the cutaneous nerve. Now we will go to the next session, where we are dividing the abdomen into 9 segments. That is 9 segments by drawing 2 vertical lines and 2 horizontal lines. Why we are dividing the abdomen from the surface into 9 segments is in order to see which organ is going to come in which segment. For example, if the patient complains of pain in one region, you should know which organ in the abdomen is situated in that region in order to identify what the problem is. So in order to do this, we are going to divide the abdomen into 9 segments by 2 vertical lines and 2 horizontal lines. So what are these vertical lines? These vertical lines are drawn by joining the midpoint of the inguinal ligament. Okay, one point is in the mid-inguinal point and the other point is the mid-clavicular point. We are joining these two. This is the vertical line. Mid-inguinal point, mid-clavicular point. And the horizontal lines, the upper horizontal plane is called as a transpyloric plane. This transpyloric plane, how we obtain this plane is, this is a midpoint between suprasternal notch and the pubic symphysis. So around here will be the line. This line passes through the tip of the 9th costal cartilage. It passes through the tip of the 9th costal cartilage on either sides. How we identify the 9th costal cartilage is the cartilage that is attached to the xiphisternum till the sternum, that is the 7th. The next one is the 8th and next is the 9th. So we draw the transpyloric plane by joining 2 points at the level of the tip of the 9th costal cartilage, and the next horizontal plane is got by, what is this point? This is called as transtubercular plane. This is got by joining the tubercles of the iliac crest on either side, which is about 5 centimeters behind the anterior superior iliac spine. 5 centimeters behind the anterior superior iliac spine. There will be a projection in the iliac crest. That is called as the iliac tubercle of the iliac crest. So we join these 2 points. This is the next horizontal plane. So by doing this, we are dividing the abdomen into 9 segments. So 1, 2, 3, 4, 5, 6, 7, 8 and 9. So now let's name the segments. This segment is called as hypochondrium. Hypochondrium, below the ribs. Hypochondrium. This is the right hypochondrium and this is the left hypochondrium. This is called the epigastrium. On either sides, this is called as a lumbar, right lumbar and left lumbar. This is, the center is called as the umbilical part. This is the right iliac fossa. This is the left iliac fossa. So these two are the iliac fossa. And this is called as a suprapubic part. Suprapubic. Okay. So these are the 9 segments. So now I'll just tell you what organs are present under each of these segments. So in the right hypochondrium, it is mainly the right lobe of liver. In the epigastrium, it is the stomach and partly the liver. In the left hypochondrium, it is the spleen. In both the lumbar region, deep to it in the abdomen, you have the kidneys. In the umbilical region, mainly it is the stomach and the small intestine. In the right iliac fossa, a very, very important segment, this is where you have the cecum and the appendix. Any appendicular pain, there will be a pain in this region, right iliac fossa. When you press, there is pain in this region, it is mostly from the appendix. Okay. This is the left iliac fossa where mainly you have the sigmoid colon. This is the suprapubic region where also you have the small intestines, the coils of the small intestines. Also you have the bladder when it gets filled. Bladder is usually below the pubic symphysis in the pelvis. When it gets filled, it enters into the suprapubic region. Also, when the uterus is enlarging during pregnancy, it comes to the suprapubic and slowly it increases in size. So these are the organs which are present deep to each of these segments. This is very important to know which organ is present where.